Hello, Dr. Sean here. I'm trying not to mention too much unnecessary or very basic information or mechanism that can be easily found. My goal is always to provide you with effective and easy to follow methods to save your time. You know what I mean, right? Today, we'll discuss how to improve nocturia, nighttime urination. The simplest method is taping your mouth shut while sleeping. However, this method is not very effective and can be uncomfortable. So, I'll share a more effective approach. Let's get to the point. One of my patients experienced a reduction in nighttime bathroom trip after using a mouth tape. That's because this person used to snore regularly. Even if you don't snore and think it doesn't apply to you, please don't go yet and check out the following information. Have you heard that snoring can increase the blood sugar levels, worsen vascular disease, disrupt deep sleep, and reduce lifespan? Many people tend to ignore it because they don't notice it while sleeping. Even if you don't snore, the inability to get good night's sleep can be a cause of a frequent trips to the bathroom at night. If you wake up in the middle of night, go to the bathroom, and only pass a small amount of urine, it might be due to the fact that you are not sleeping deeply enough. In this case, improving your sleep quality is important. Let's go back to snoring. 50% to 80% of sleep apnea patients experience discomfort due to nocturia. This doesn't mean that snoring is cause of all nighttime urination, but if you snore heavily, improving snoring can also improve nocturia. Snoring can lead to improper breathing, which lowers oxygen level in the body. This can cause our body to produce peptides that stimulate the bladder and make you urinate. Using mouth tape to keep your mouth closed allows you to breathe through your nose, reducing snoring and improving nighttime urination. If you're dealing with a really stuffy nose and can't breathe through your nose with your mouth shut, you might want to try nasal decongestive spray like Otibrine to see if it helps with your nighttime urination. But remember, don't use it every day. Using it too much can actually make things worse. Use it as a test run to see if it helps. If it helps, regular nasal care such as a nasal rinsing with a neti pot or this 2 or 3 times a daily to clear your nasal passage is important. Now, if you think you don't snore, don't have sleep apnea, and believe you're sleeping well, but you still have frequent nighttime urination, please check this. It's called dependent edema, or simply swelling in the lower body. Swelling in the legs occurs because blood pools down there, often affecting people who have jobs that involve long periods of standing or those who do extended period of driving. Our heart pumps blood all the way down to our toes, and it needs a force to push back up against the gravity. That force comes from movement of our leg muscle and negative pressure created in the lungs during breathing. If someone has a reduced lung capacity and limited leg movement, blood may pool in the legs, and this can lead to swollen and heavy legs, a condition known as a dependent edema. Now, what happens when you lay down? Let me explain using this water bottle as an example. So this is a heart, this is your lower body. Once you lay down, see, the blood levels up, it goes up. So much easier for your blood to travel back up. As you saw, when you lay down, the blood that was pulling in your leg has less gravity pulling it downward, allowing it to move back up. This can help increase urine output. So, in simple terms, if you often experience swollen and heavy legs and frequent need to use the bathroom at night, try elevating your legs while you're resting or watching TV instead of sitting down. And then when you're doing so, don't cross your leg like this and just leave it like this. If you're interested in getting some help beyond doing this, consider taking supplements. Supplements have faster results. You know about Go-To-Cola, right? Just take that. But if you're not sure if this is helping, you can also try adding propolis. Propolis not only has anti-inflammatory properties, but also contains flavonoids that can help move the pooled blood from your legs upward through your lungs. Start with the go-to cola, and if you don't see much improvement, you can try it with propolis. Now, if you don't have a sleep problem, swelling, and still experience frequent nighttime urination, please check this as well. Do you urinate enough during the day? People who experience high levels of stress tend to have an overactive SNS, sympathetic nerve system. An overactive sympathetic nerve system can suppress not only urination, but also bowel movements, digestion, and sleep. If you find yourself urinating less during the daytime due to the stimulation of the sympathetic nerve system, you may end up releasing that urine during the night when you finally get some rest. In such case, it's time to do some stress control. Managing stress can be challenging, even when you're practicing yoga or meditation. If so, consider visiting an Eastern medicine clinic, as it can be more helpful. If you're interested in trying supplement, lecithin can help stabilize your body when you're stressed. However, be cautious, as a lecithin can act as a diuretic. Only use it if you have a trouble urinating during the day due to excessive stress. Also, among those who deal with the frequent nighttime urination, some might have diabetes. See, high blood sugar level can cause your body to produce more urine. If you have diabetes, you drink more water to dilute high glucose levels, leading to increased thirst and frequent urination at night. Keeping your blood sugar in check is super important if you want to manage those nighttime bathroom trips when you have a diabetes. I will make a video about managing blood sugar level in the future. Nighttime urination is pretty common, especially among women aged 9 to 45, and it tends to happen more often in men over 60, mostly because of prostate issue. I'll be making video on how to relieve symptoms of prostate enlargement. I have a plenty of topic to share with you, and I will do it step by step. So please don't forget to like and subscribe. Remember the method I shared today. However, the most effective solution is prescription drug. If you have a bladder inflammation or enlarged prostate, these are medical conditions. So try prescription drug first. If they don't work well or symptoms return when you stop taking them, then consider a method I mentioned earlier. Or you can also visit Eastern medicine clinic. Eastern medicine can be very effective. Like I said earlier, I have so much to say and I'll cover various topics that can help you. But if you have a specific topic you'd like to hear about, please leave a comment below. I will study and research them for you. Until next time, stay healthy.